Hello, everybody. So, the topic for our presentation today is periodontal disease and adverse pregnancy outcomes. This is presented by myself, Puneet Chandra, Vijeta Chandrasekhar, Lucy Frenzy, and Manisha Joy.
Periodontitis is an inflammatory condition caused by bacteria that invade the connective tissues surrounding the teeth, such as gums and bones. In the early stages of the disease, it can cause symptoms such as tender, red, and swollen gums. In severe cases, the gums can pull away from the teeth and the connective tissues loosen, which can cause the teeth to fall out. It has been suggested that the hormonal changes during pregnancy, particularly the marked increases in estrogen and progesterone, may be in part responsible for the increased risk of developing periodontitis. Other possible factors that may be involved in the etiology include changes in blood flow to the gums. Plaque buildup on teeth can lead to tartar, which, if left untreated, progresses from gingivitis to periodontitis. As the condition worsens, the body's immune response to the bacteria causes the destruction of surrounding tissues and bone. This creates pockets around the teeth where infection can take hold, further exacerbating the damage. Several risk factors contribute to the development of periodontal disease, including poor oral hygiene, smoking, diabetes, hormonal changes, and genetic susceptibility. If left unmanaged, periodontal disease can lead to serious adverse outcomes such as preterm birth, low birth weight, and preeclampsia, highlighting the importance of maintaining good oral health, especially during pregnancy. This is the flowchart about periodontitis and adverse pregnancy outcomes and its risk factors.
Reaction of the immune system to pregnancy. Placental immune response makes a pregnant woman susceptible to infectious diseases. The cells responsible are macrophages, regulatory T cells, natural killer cells. The immunological response of the mother and ultimately the fetus are outcome of the type of response initiated inside the placenta. Things to consider would be, are pregnant women more susceptible to infectious diseases? Are treatment and prophylaxis appropriate and of benefit to the pregnant women? Pregnancy gingivitis. This is a condition commonly seen in pregnant women. In this condition, there is inflammation of the gums. If left untreated, it can lead to periodontitis. There is sudden increase in hormones, specifically estrogen and progesterone. There's bleeding while brushing, swelling, redness, and tenderness. This is commonly seen during pregnancy and goes away after delivery. Brushing and flossing twice daily and gargling daily with saltwater rinse will help. It's prevented and managed with routine dental visits while being pregnant and with good oral hygiene.
So, next, we're going to discuss pyogenic granuloma. It is a benign acquired vascular tumor. Clinically, it is seen as a red pedunculated solitary papule, which is also friable, seen in second or third trimester of pregnancy. It is also called granuloma of pregnancy or epilis gravidarum. Shows up as bleeding gums, inflammation, and eating difficulty. The exact etiology of pyogenic granuloma is unknown, but there are some triggers such as trauma, chronic irritation, lesions of the vascular system, also plaque and calculus. There could be imbalance in anti-angiogenic factors and pro-angiogenic factors that can trigger pyogenic granuloma. So now we're going to discuss the etiology based off of hormones. During pregnancy, there is increase in hormones such as estrogen, progesterone, and chorionic gonadotropin, resulting in alteration in microcirculatory system. This further leads in swelling of endothelial cells, platelet adhesion, increase in vascular permeability, damage of mast cells, increased levels of aerobic and anaerobic bacteria, including bacteria such as Fusobacterium nucleatum, Prevotella intermedia, Porphyromonas gingivalis, which further leads to cellular changes. The keratinization of gingival epithelium is decreased and there is an increase in fibroblasts and glycogen, resulting in damaging of epithelial barrier and results in an exaggerated response to biofilm and gingival inflammation, which is pyogenic granuloma. Although there needs to be more research, but some studies are suggesting that deficiency of vitamin D during pregnancy can cause periodontal disease. This further results in preterm birth and low birth of babies. The invasive bacteria has the ability to penetrate into the amniotic fluid and the fetus. If the body fails to fight the infection, it can result in rupture of the membrane and thus lead to premature birth and low birth weight. During pregnancy, along with other blood markers, importance should be given to oral health and screening of serum vitamin D levels.
So next we are going to discuss about advantages of getting teeth cleaned before and during pregnancy. Reduce risk of periodontitis. Professional dental cleaning helps remove plaque and tartar, reducing the risk of gum diseases, which can become more severe during pregnancy due to hormonal changes. Next is decrease inflammation. Regular dental cleaning helps minimize inflammation, which is important as inflammation can potentially affect pregnancy outcomes. Improved oral health, good oral hygiene, and regular dental visits contribute to better overall health, which is crucial during pregnancy. And the last one is better management of existing conditions. For women with existing dental issues, addressing them before pregnancy can prevent worsening conditions that might be harder to treat during pregnancy. So, next is about disadvantages of not getting teeth cleaned before and during pregnancy. First is the increased risk of periodontitis. Without proper dental care, the risk of developing periodontitis increases, which can affect both maternal and fetal health. Higher inflammation levels. Untreated gum diseases can lead to chronic inflammation, potentially affecting systemic health and pregnancy outcomes. Increased dental problems during pregnancy. Hormonal changes during pregnancy can make gums more sensitive and susceptible to plaque, making existing dental issues worse if not managed beforehand.
So these are some of the future directions for pregnant ladies with periodontitis. Take calcium-rich diet, have appropriate amount of vitamin C, vitamin D, omega-3 fatty acids, and folic acid. Take phosphorus-rich diet, avoid sugarly and acidic foods, always stay hydrated, and need to take plenty of probiotics. So this is the education part. Explain periodontitis and its relation to systemic disease, potential risk during pregnancy, importance of oral hygiene, then a dietary recommendation, then need to tell them about importance of regular dental checkups, lifestyle modification, and how to manage periodontitis. So this is a fun fact. Pregnant women smile as a superpower. When you smile even in periodontitis, it releases a hormone called endomorphin. These feel good hormones reduce stress, which is great for pregnant lady and her baby.
And these were the sources we used to put together our video. Thank you for listening.